last 4 years, Howard University has joined the global community in celebrating International Women's Day, and this year is no different. Around the world, progress has been made over the last couple of years with women rising into leadership positions. The recent election of Howard alumna Kamala Harris as the first woman to occupy the position of Vice President of the United States of America sent a strong signal that progress towards women's leadership is still possible. The recent confirmation of Dr. Ngozi Okonjo-Iweala, a woman of African descent from Nigeria, as the first woman and the first Black person to be Director General of the World Trade Organization, also lends support to the fact that women are rising up into leadership positions. Despite the progress being made at the international level, challenges still remain. And on this day, as we celebrate International Women's Day, we come together to reflect on the progress, but also strategize on how we can move the agenda forward. At Howard University, we have seen the role played by women in the fight against COVID-19. Report by United Nations Women issued last year shows that women have been disproportionately affected by the COVID-19 pandemic, whether due to the increased levels of domestic violence, or the tightening of economic opportunities, or the increased burden for women who have to balance their working obligations from home with their child care obligations. Women have been pressed in different places. So today, as we pause to celebrate women around the world, let us be reminded of the roles that women have played in the fight against COVID-19. At Howard University Hospital, women have been at the forefront as doctors, nurses, technicians, and all the other staff personnel who have worked tirelessly through research, through community engagement, through caring for their patients, and also helping with the vaccination drive to ensure that the Black communities that they serve are not left behind during this COVID-19 pandemic. So as we pause to reflect and to celebrate, it is our privilege to honor our women leaders at Howard University and to encourage all others to join us in the fight for women's voices to be heard and for women's places at the table, decision-making tables, to be acknowledged and to be recognized. At Howard University, that is already happening. Increasing number of women as deans in our colleges, and also with women in leadership positions at Howard University Hospital. Thank you once again for joining us in this celebration of International Women's Day 2021 as we pay tribute to the Howard University frontline workers. Thank you.
Hello everyone, happy International Women's Day 2021. I'm so grateful to be able to participate in Howard's commemoration of this very important day during what is already proving to be one of the most important and momentous years in our nation's history. The ascent of Howard alumna Kamala Harris to the Vice Presidency of the United States is clearly a significant victory for the advancement of women in our society. But it is also representative of how female leadership has always guided and given momentum to our national progress. For her journey to the White House to have taken place at all is the result of so much hard work and dedication by generations of women who came before her. The influence of women in positions of power has been abundantly clear throughout the pandemic. Across the country and from all strata of life, women on the front lines have helped keep people safe and informed. Whether they are doctors or nurses, administrators, receptionists, or technicians at home or nursing home caregivers, so many women have continued to go into work every day during the pandemic in order to serve their community. At a time when many people were hunkering down in their homes to keep themselves safe, these women were going into work many taking public transportation in order to get there, to make sure that people suffering from COVID-19 were getting the care and treatment they needed. Of course, they thought about the risk they were taking on, but they simply did not let any fear they felt get in the way of the duty they needed to perform. At Howard University Hospital in particular, these women were primarily serving people in underserved communities. They worked hard to limit the devastation of a pandemic that has disproportionately affected African American men and women. Even as the death toll has climbed higher and higher, surpassing 460,000 deaths as of this week, they recognize the vital significance of working to save every single life. But more importantly than the impact of their individual actions was their influence. The speed of and the spread of their leadership. By going into work, they inspired others to do what they could to help and to help destroy this pandemic. By getting vaccinated, they helped inform people that the vaccines are safe and encourage others to get vaccinated so they could protect themselves, their families, and those in their community. The pandemic didn't turn these women into heroes. They have always been just that and will always be the heroes of our community and at a time when we need them more than any other time. Even when times return to normal and our situation as a country stabilizes, may we continue to see these female frontline workers as the warriors and leaders that they are. Our society will be better if we recognize their contributions and foster an environment where female leaders can prosper. Thank you all so much for your service.
Hi, my name is Anita Jenkins, CEO of Howard University Hospital, and I'm honored today to acknowledge the 5th annual celebration of International Women's Day at Howard University. It is the perfect platform to raise awareness for our women frontline healthcare heroes at Howard University Hospital as well. During this deadly pandemic, it has been our women who are leading the charge to combat COVID-19, leading the charge while they are wives and mothers and heads of households. Congratulations. Their commitment and dedication to our patients and this community is a testament of their professionalism and courage. Historically, women have been a part of every major global health crisis. They are also the majority in global health workforce, comprising 70%, but very scarce in its leadership ranking. Only 25% of leaders are women. We need more women taking the lead on global health policies and emergency responses, which will inevitably translate into positive change. What you do today and on will determine if our destiny continues to blossom. I am proud to be a part of your endeavors at the Center of Women, Gender, and Global Leadership at Howard University. Thank you. Thank you very much.
Hello and greetings to the Howard University community on this, your 5th annual celebration of International Women's Day. I'm Jennifer Porter, Executive Director of the Office on Women's Policy and Initiatives for Mayor Muriel Bowser and a proud Howard alum. This year, your theme, Women in Leadership, a tribute to Howard women frontline workers, could not be more fitting. And I join you and Mayor Bowser in honoring the heroic women of Howard University Hospital who've led in research, vaccination, and clinical trials, and supporting the everyday operations of the front line of our city. These women have bravely worked through one of the most critical times in our history and have at the same time contributed to our communities, our families, and children at home while continuing this fight. On this International Women's Day, we honor the sacrifice of women across the globe and focus on the importance of fighting for women's equality everywhere. We know that women will continue to lead further action, research, and resources for our community to work to address the underlying factors that contribute to African Americans and Black women being more susceptible to this terrible disease. Howard has been and continues to be a pillar in global leadership, and that is in large part to the women who lead it. Thank you for your service, and we continue to stand with you in this fight to celebrate you.
First, I'd like to thank you for including me in Howard University's celebration of International Women's Day. I'm honored and humbled that you've asked me to share with you my reflections on this day. International Women's Day commemorates the movement for women's rights and highlights the academic, social, economic, cultural, health accessibility, and political achievements of women. At the same time, though, we're forced to recognize how much further we have to go in achieving health equity in these areas for all women, Black, brown, and indigenous women, poor women, transgender women, women who have been traditionally left out of the conversations and the benefits of women's advancement in this country. This is particularly noticeable in healthcare, not only in terms of who has access to care that they need and deserve, but in industry leadership positions as well. In the United States, women consumers make 80% of the healthcare buy-in and usage decisions for themselves and their families, and make up 65% of the healthcare industry workforce. Think about your own responsibilities and roles in your families, the roles that you play among your friends and your colleagues, the number of times that you are called when there are doctor appointments that have to be made for you and your family, when you're caring for elderly family members, when you are filling out the emergency contact, who do you put down? How many people put your name down? More than likely, it was mom or other women in the family that handled those responsibilities. Women also make up a significant number of clinicians, physicians, nurses, and other healthcare personnel. And thankfully, this has grown over the years, especially since women have always traditionally cared for the ill, delivered babies, and managed the health of others. So it's only natural that we should be in these roles. We're also excited that there's also been a significant growth in the number of Black women going into the medical field in a variety of roles, from research to patient care. We've also seen the proportion of women medical students rising over recent years, from 46.9% in 2015 to 49.5% in 2018. In 2019, actually, women comprised 50.5% of all medical school students. The number of Black applicants rose also by 0.6%, and the matriculants increased by 3.2%. Among Black or African American men, though, the applicants and matriculants number only increased by 0.5%, and we continue to see a lack of increase in numbers of Black men coming to medical school at rates that are comparable to Black women. So while there are many gains and many reasons to celebrate, they simply aren't enough. More Black doctors help level the playing field for Black patients. Study after study proves that when Black patients receive care from Black doctors, they have better outcomes. Concordance between providers and patients also encourages compliance with directives regarding self-care and managing conditions such as hypertension, diabetes, conditions that unfortunately disproportionately impact the Black community. Earlier, I referred to the issue of women in leadership, particularly of that in healthcare. For me, as a president and dean, as a person who has served in every level of academia, I have been very fortunate to have many mentors guiding me throughout my career. First, they believed in me They believed in what I had to offer. They believed that I was ready for the next level, and they gave me opportunity. But how many institutions, colleges, universities, and even public and private companies have programs and initiatives in place to guide and develop the next Dr. Valerie Montgomery Rice? And if they do, are they measurable? Have they been successful? What we see currently in the healthcare leadership and in industry provides us with our answers. We must do better. Morehouse School of Medicine and Howard University, since the first bricks were laid, have worked to not only build trust and health equity among populations that have previously been abused and ignored, but also to produce those doctors that the world needs most. Many of those doctors are Black doctors. We've been successful in building the skill set and knowledge needed to work effectively in leadership positions. We both have much to be proud of in driving an agenda of not only creating more Black doctors, but ensuring Black women are prepared for leadership roles. So my call to action on this International Women's Day is to celebrate, but also do the real work of advancing women into leadership roles in healthcare, beyond just being a president and dean, but into those many industries like pharmaceutical care, like research at the NIH, leading the FDA, leading the CDC, where decisions are being made every day that will impact the care of millions. We are still required to make a difference. And I know that as women, we will continue to do so.
My name. How could you forget my name? I held it close to my core, or lack thereof. Never let anyone get too close to it, or maybe I did. Or maybe you could never respect my boundaries. To be a person that constantly has things taken away from, my name meant everything to me. I's dotted, A's swirled, T's crossed ever so perfectly. But all you ever saw was the black hole in the eye. My name was never meant to be on a t-shirt, unless airbrushed or rhinestone, never meant to be capitalized, only the first letter of my name. Never meant to be dangled on earrings. I've already been lynched once, but here we are again. I wonder if my name truly meant anything to you. Did you ever notice the rolled R, or the apostrophe over the I, or the drawn out at the end? Or did my body do it for you? Speak my name for me, quickly. Invoke my spirit while I am still alive. Sing me my praise before you engrave my name on grindstone. Praise me like God, spite me like the devil. Enjoy my fruits, but wallow in the stomach ache of gluttony. Pick me bare and start to look for the next tree of life, but let our pollen travel. Let it germinate into new gardens, and let those trees whose soil we've woven and whose rows we've braided grow to be appreciated, and not rely on your dirty farmer hands, but wrap their branches around each other. Let that garden grow wildly, and let you be barred from entrance, and let the garden be named community, and may its name be a secret.
At Howard University Hospital, women have shown strength, resilience, and leadership as frontline healthcare workers, caregivers, and community organizers. This year, we come together to acknowledge and celebrate the leadership and dedication of Howard University women frontline workers in the fight against the COVID-19 pandemic, celebrate their leadership, emphasize their roles they play in our community, and stressed the necessity of their expertise, knowledge, and service. The following honorees represent women leaders at Howard University Hospital and Howard University, serving their community. Dr. Gina S. Brown. She currently serves as the Dean of the College of Nursing and Allied Health Sciences at Howard University. Dr. Monica N. Daftery. She currently serves as a professor and chair of clinical and administrative pharmacy sciences at the Howard University College of Pharmacy. Dr. Deborah Holly Ford. She is the Senior Associate Dean for Academic Affairs, Associate Professor of Surgery, and Head of the Section of Colon and Rectal Surgery for the Howard University College of Medicine. Dr. Jhansi Jahala. She currently serves as Infectious Disease Specialist at Howard University. Dr. Siham M. Magoo. She currently serves as an Infectious Disease Specialist at Howard University. Dr. Celia J. Maxwell. She currently serves as the Associate Dean of Research at the College of Medicine and is an Infectious Disease Specialist at Howard University. Dr. Gail Noonley Bland. She currently serves as the Chief of Endocrinology and Director of the Diabetes Treatment Center at Howard University Hospital. Anita L. A. Jenkins. She currently serves as the Chief Executive Officer at Howard University Hospital. Dr. Shelley McDonald Pinkett. She currently serves as the Chief Medical Officer of Internal Medicine at Howard University. Dr. Tamara L. Owens. She is the Founding Director of the Clinical Skills and Simulation Centers at Howard University Health Sciences. Dr. Toyin Tofade. She currently serves as the Dean of College of Pharmacy at Howard University. Dr. Lori L. Wilson. She currently serves as an Associate Professor and the Chief of Surgical Oncology at the College of Medicine at Howard University. Ladies, thank you for your service and commitment.
As the saying goes, every good thing must come to an end. Thank you for joining us in celebrating International Women's Day at Howard University. To all our honorees at Howard University Hospital, thank you for your service. And to all our speakers, our special keynote speaker, Dr. Valerie Montgomery Rice, Dean and President of the Morehouse School of Medicine, thank you for making time to be with us. To all the administrators at Howard University, thank you for your continued support and commitment to promoting gender equality and making Howard University a community of inclusiveness for women and other minority groups. Our special thanks also go to Mayor Muriel Bowser for supporting our programming and for being a leader who is conscious about women's issues across the spectrum. To all our students and audience, thank you for coming, and we wish that we invite you to continue to engage with us and to engage with the Center for Women, Gender and Global Leadership, a center that promises to change the narrative and to create spaces for continued engagement on discussions across the spectrum on women, gender, and global leadership. Thank you once again. Have a wonderful rest of your day, and we'll see you again soon.